That's awesome.
We are so happy to see that. That's Inside Edition correspondent Alison Hall. She is back on the job after undergoing successful surgery to treat breast cancer. Did you hear that? Successful, yay. Last month, Hall underwent a double mastectomy after being diagnosed with stage 0 of the disease. She learned of her cancer after reporting on actor Olivia Munn's own cancer treatment. So she took the same risk assessment test that Olivia Munn did, a move that may have saved her life. In post-surgery, Hall's doctor shared some very good news.
So the pathology results were wonderful. We got all the cancer out. There were no surprises. It was exactly as we had expected.
Amazing. So can I officially say I'm cancer-free?
You are definitely cancer-free.
Wow, music to my ears. We're very happy to say that Alison Hall joins us now. Do you feel as good as you look, Alison? We're so happy for you.
Thank you, thank you. I really do. I feel great. I'm so happy to be here. I'm so happy to be back and have this chapter starting to close for me.
What does stage 0 mean? I'd never heard that phrase before, stage 0. What does that mean?
Stage 0 means that the cells have just turned into cancer. They've just turned malignant. It has not spread anywhere else yet. And it's the earliest.
It's there.
It's there, and it's the earliest stage that a cancer can possibly be caught. So it's pretty incredible.
So after the cancer was caught, you had some treatment options, some decisions to make. Walk us through those decisions and why you ultimately went with the double mastectomy.
Yeah, absolutely. So I learned about my cancer, and they said that I could do a lumpectomy and radiation and hormone therapy. Or I could do a double mastectomy, which would treat the cancer that I had on my right breast, but also dramatically reduce my risk for future cancer. So I took a look at both options, and knowing at the stage of life that I'm in, being a young woman, I hope to have a family one day, I wanted to do something that would reduce my risk. My doctor has told me that I now have a less than 3% chance of ever having breast cancer again, which sounded pretty good to me.
Yeah, but take me through the night before the surgery. I don't want to be inappropriate or impolite, but I'm curious about your feelings, because I was thinking if it was me, what would I do? I would stand in the mirror and just look at my boobs one more time, might have a conversation with myself. What did you do?
That's exactly what I did. That's exactly what I did. I took a shower, I had a good cry, I listened to my favorite music. I looked in the mirror.
What'd you listen to?
The Head and the Heart, a folk band I love.
Okay.
And I looked in the mirror and I thanked my breasts. I said, thank you for your service. You've given me 33 good years, and it's time to move on.
Yeah.
I'm ready for this new chapter, and I'm ready to not live in fear.
At the risk of being inappropriate, I'm just asking a follow-up, because I was curious too, and as a man, I don't know how to ask. Do you miss your breast?
That was my next question.
You know what? I really don't. I decided to go the reconstruction route, so I'm doing a 2-part reconstruction.
Gotcha.
So when I woke up, I did look down, and things looked a little different. But I have started the reconstruction process where I have temporary implants currently, and then they'll replace them with more permanent implants in a few months.
Gotcha.
But I still feel like myself, because this new body of mine is built from a place of strength and control, and I don't look down anymore and think, what's going on in there? Is there cancer there?
You're pleased with the results?
Yeah, they look surprisingly great.
So you are back to work, and a few people that you may be familiar with wanted to send you a little message. So check this out.
Welcome back, Alison.
Hey, Hall, welcome back.
Alison, I'm so proud of you. Alison, you are an inspiration. Thank you so much for your courage, your guts. You are a warrior.
Thank you for teaching us that we have to be proactive about our health, that we have to ask the right questions, and most importantly, as you did, learn to trust your gut.
How you've handled this with such courage and such grace is such an inspiration to me and to countless women across the country.
You have grace and empathy, intelligence and tenacity, and you are changing the world one story at a time.
We missed you so much, and we're so glad you're doing okay.
We appreciate you, we honor you, and we're so excited to have you back.
We really are. That's so nice. Those are your colleagues, of course. I know this story came to you through Olivia Munn, and we showed Olivia Munn reached out to you through us and given a message to you. I've heard that you two have communicated with each other.
Yeah, she's been absolutely incredible. After our segment here on CBS Mornings, she reached out privately and offered even more words of encouragement and love, and it just meant so, so much to me. I will forever be in debt to her.
How much time did you take off? Because it seems only yesterday, honestly, that you were here. I know it wasn't, But how much time did you take off?
I was off work for a full month,
Okay.
4 weeks, which felt really good to me. And of course, Inside Edition has been incredible, saying if I needed more time or if I need to take a day here and there. But after about 4 weeks, I was really anxious and eager to come back.
All right. And so the takeaway for people is get that screening.
Get that screening, absolutely.
All right,
All right,
Alison Hall,
Allison.
thank you.
Bravo.
We're so
Thank you.
impressed. We're so happy you're doing better.
Yes.
Thank you.
And if you want to see more of Alison's reporting on Inside Edition, you can. All you got to do is check your local listing.